Okay. Hi, Shea.
Hi, Emma. Happy birthday, by the way.
Oh, thanks for announcing it to everyone. Yes. Here we are on my birthday. You're going to do the Craniosacral Chat Part 2 with Shea Stewart. I really appreciate your time and you making time for this. So thank you for coming. And what are we going to talk about, Shea?
So we are going to talk about pullback injuries and head traumas and how it can relate to all kinds of problems in the body.
Yeah, there's so much to cover here. And this webinar, this little Zoom call will be about 45 minutes. So we might not be able to cover everything, but we'll do what we can. We've certainly had a couple of questions, haven't we, from some people we'd like to touch on. I think what I'd like to start with is just so people, because we might have a wide audience here, we'll have people that know all about pullback injuries. They might have a horse that's had one, or they might not even know what that means and what it entails. So perhaps if we start there, you know, what is a pullback injury and why it's so important to address this, even if it's small, and why hard tying horses can be very, very dangerous. Obviously, Shay's got an extensive background in horsemanship as well. So I'll let you comment on this.
Yes, I can talk a little bit about that. I can also get my skull and show things. But yeah, so a pullback basically means when a horse is tied up and they pull against the rope and hit it hard, I guess.
Yeah.
I don't know any other way to say it, but it's basically when they're tied up and they pull against the rope. And that usually causes panic in the horse. So they then pull even harder. And sometimes they may pull multiple times until somebody can get them untied.
Yeah.
So that's basically what a pullback is when we say a horse that's pulled back. And what that does is it puts extensive pressure on their head and their neck, their facial bones, soft tissues. It can even put pressure on their brainstem. That's why I was going to get my skull so I can show like where the
Oh yeah, the one behind you. Yeah, go get it. Yeah.
Sorry, I should have gotten this out before.
No, this is I love it. I love it.
So here's my skull. My horse is not beautiful. My horse. Isn't that pretty?
It's beautiful. Did you? I love it.
I painted it before a craniosacral class and I thought I'll paint the skull real quick.
Took you how long?
Yeah, like 6 hours. I was up all night. So basically, here's the top of the head and the ears are going to be on either side here. So a halter is going to be about right here, the rope from a halter. And if you can see back here, this is the foramen magnum. This is the hole that the spinal cord comes out of. And actually on a horse, part of the brainstem comes out of here as well. So it's not protected like ours is. Ours is pretty protected here.
Yeah.
So any downward pressure on this area, you're going to press basically right on the brainstem and spinal cord. It's a few layers deep from muscle and ligaments, but that soft tissue is still, it's not totally protecting it. It's still, everything's going to push down and you're going to have the strain this way. So you're already straining the joint where the occiput meets C1. You're already straining this with the horse pulling his head this way against the rope. And then if you look at,
Yeah, great.
so all these bones, see how all these bones are connected?
Mm.
This is the occiput, temporal, sphenoid. These bones are connected like puzzle pieces. And anytime these little joints here get compressed together, it's going to cause this breathing motion that they need to do. It's going to strain that. It's going to stop that motion. And that alone will put a horse into a sympathetic state, which is fight or flight state. And it'll set all these bones where they're not moving how they should. And in a parasympathetic state, there's a nice fluid breathing motion that these bones do.
I love
This sphenoid bone that's connected to the occiput. So the occiput's pretty big. And if you look underneath, there's a sphenoid bone. It's one of the bones that houses the eyeball. So the
yeah, you can see just inside, it's the rear socket of the eye.
right back in there.
And it has a beautiful window in it, doesn't it, where you've got all the cranial nerves that move the eye go through that.
Yeah,
So
you can, I don't know if you can see there's
yeah
little holes right in there. That's the cranial nerves go through that right into the brain.
Yeah.
And those, so you can, if your horse has had a pullback, and one thing that we look at when we do cranial is how well are their eyeballs moving in their eye socket. And I find, I don't know if this is true with you, but a lot of horses, they'll move their eyes a certain amount and then they'll strain their head.
Yeah.
And then you do some cranial on them and their eyeballs free up.
Yeah, because the eyes have such a direct connection to the neck. Obviously, the neck muscles and the orientation, your eyes move and then your whole body moves. It's so important for horses because, I mean, obviously it's important for us. It's akin to a nasty whiplash. I've got some, I asked Sharon May Davis if I could get her permission just to use some dissection photos that I took. She said yes, she's very excited about this talk, just so you know.
Oh, for our talk?
Yeah, so that's
right
great.
Oh, great, cool.
Yeah.
Love to see that.
Yeah, just so that people can see what's underneath. So I've got some just some head dissection photos. But what's interesting, going back to the pullback, because like you said, they'll pull against the rope, and most people will use their baling twine or a quick release. That's great. I just want people to understand, from a mild to a severe, any pressure against that head needs to be taken seriously, doesn't it? Yeah.
Yes.
Any pressure. You got to think about the type of headgear you've got on your horse as you're tying them up. Rope halters are very common. My feeling personally is if you're tying your horse, to just have a soft halter. Because those rope holders do a lot of damage. They go straight into exactly where Shea was showing, around that top of the head. All those muscles feed into the dural fascia of that spinal cord and the brain. So it's just got that intense stretch effect or compression effect when that pressure's there. I saw a horse the other day who was hard tied, obviously with a quick release, but he'd pulled back. And his owner said, he pulled back so hard I couldn't untie the knot and I had to cut it. So if a horse panics, and pulls back, they're going to do whatever they need to do to get away, even if it means breaking their own neck. You know, and there is no way in the world you can quick release that knot when they've put 500 kilos plus kinetic force. That's a ton of pressure on that rope. So it's just so, I mean, that's why the work that you and I do, like we'll say again and again and again, it's so important to really take these injuries very seriously, to let the horse know that they can move and get away if they need to, if they get scared. Yeah, I feel very strongly about this. This is why we're doing this talk. But yeah, I'll just I'm going to share screen. Let's see if Emma can do it this time. Now, I'm just going to find the photo first, and then, so what do we want to look? What do we want to look at? Perhaps you could talk us through it if I send you some. Here we go.
I wish we had a picture. You know what I would love to show pictures of is a diagram of the deep suboccipital, the muscle fibers that go through the occiput into the dura.
Yeah.
Because
yes.
I think that's something, I don't know if people understand that it's the dura is the lining of the, how would you explain that? My brain's all over the place.
I know, because there's all this information. We want to say it all at once.
I know. Right? I know. There's actually muscle fibers that go into the brain, basically. Mm-hmm. So any strain on the back of the head, that pressure is going to go into their brain, which is all back in the back of their skull.
Exactly. So I'm going to try and pull up, I'm going to pull up that one as well. And then I'm going to share screen so you can have a look. Okay. So let's look at this one. See that? Does that come up okay?
Yeah.
Yeah.
Yep.
So this is just the superficial muscles here. So let's just imagine there's a force pulling down behind the ear. So there you've got the suboccipital muscles are all here on us, and the horse has got your rectus capitis lateralis. The ventralis we'll talk about as well, which I think you've dealt with a horse that's had a rupture there. You see behind the ears, you've got the parotid gland here. Is my mouse there? Can you see that? Probably
Yep.
not. Oh, you can?
Yes. Yep.
So
I can see.
Yeah. So if you've got a rope halter and there's pressure there, that can get really affected, right?
Mm-hmm.
So can ear movement. Yeah, sorry. And just as Shea was saying, that pull down here on the OA joints, the OA space known as the pole, that's going to affect the dura, that tight, that very, very strong fascial system called the meninges, that encase this part of the skull and the brain. They're continuous. It's all continuous down here, all continuous back there. So if you can imagine a horse having a pullback, they will then have this huge tension across the front of their face as well because of the forces. So I guess what we're saying is it's not just here that gets affected, it's everywhere and further back, which we'll look at. I'll show you another one. Let me just pull up. Does that one show up?
Not yet.
Not yet. How do I, do I come out of that? How do I come out? Hang on, let me get, there we go. That one? Oh no, I have to go back. This is Emma still trying to figure out Zoom. There you go. Okay. You see that one?
Wow.
Yeah, so this is probably giving you a better idea for what you can talk about, Shea.
That's a really cool picture showing the ligament.
Yeah. So look, this is where your bridle sits, right? Right here.
Yeah.
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 This is where that rope holder or the regular holder sits. Yeah.
Yeah, right in between the occiput and C1.
Mm-hmm.
And that's, and keep in mind, that's the only joint in the spine that has that lateral flexion.
Yeah. Yeah, absolutely. So what Shea was talking about, these deep muscles here, which Sharon has dissected away. So we're looking at the cybernetic muscles down here. they're the ones that get affected and also are connected into what they call the myodural bridge. So cerebral spinal fluid will affect, goes down into these muscles from the spinal cord, which is deep in here. There's a muscle under here called rectus capitis ventralis that when a horse has a severe pullback and then flips over because they've pulled back so hard it's broken and they've gone over. I've seen it happen in the cross ties as well, where they've just gone, whoa, or that can get ruptured, and that attaches to that bone that Shea was talking about, the basisphenoid and the basiocciput. It attaches up here. Now, was that mare you treated with Ryan all those years ago? Did she fracture? Was it temporal she fractured? Or did she fracture under here?
She fractured under there.
Wow.
Right around
here.
The sphenobasilar joint, right around at that joint. It's where she fractured.
That's crazy. Because I mean, often the prognosis for that is poor.
Yeah. And I saw her not too long ago, and she's seems okay. I mean, she's not I wouldn't ride her, but the trainer kind of just retired her.
That's good. I mean, it's just so beautiful that you got to go out and help her.
That was an amazing session. Yeah, that was quite intense.
Yeah, I remember you describing there being this intense pull through her system.
Her entire system was pulling off to one direction. Wow.
Yeah. And that's, I think, what Shea's talked about in her posts and what we talk about in craniosacral work is, there are fluid forces at work in the body, and everything is in a healthy state as kind of a unified whole. Now, if there's been a kinetic force coming in one way and meeting another force like a restriction, you can imagine what happens to that. It's sort of like a river getting stuck. And then you get these forces pulling in a direction, and the horse would have felt completely out of her body almost. Right? Yeah.
Yes. And I have to say, it's not just pulling back while tied that can cause these forces. Tight bridles.
Yeah.
And I see a lot of, in certain disciplines where they have their nose band tight, I cannot even get my thumb under the crown piece.
Yeah.
And that will cause that same pressure. We're looking at that same pressure. So that spinal cord was right out of that hole, you could see. And then the nuchal ligament attachment was up here.
Yeah. I'll see if I don't know if I've got a picture of a tight bridle. I think I do. Let me pull that for you. Photos.
I have a picture. I don't know if it's of an advertisement for an anatomically correct bridle.
Oh, yeah.
Pressing on all the wrong places that I could show.
Do it. So this is kind of what you're talking about. So imagine having an elastic band really, really tight around your head every day or 5 days a week. See where I put the circles? There's a lot of pressure there. And then you remember that dissection photo. Look what's underneath.
Yeah. And see, not only what's underneath, but where the temporal bone is. I wonder if you can show it on, I don't know.
I'll stop the screen so you can.
Let me get my other skull. Maybe it moves. No, they're all
sort of ossified a bit.
Ossified, yeah. The petrous. I was going to show that.
Actually, I think I've got just a diagram, but I'll pull it up. It's from. Let me go back here. Oh no. So. It's here. Here we go. Share screen. There. So I think we're talking about the temporal bone where the bridle sits sort of back here. Is that what you wanted to show a bit more?
Yeah, the petrosal
Oh, yeah.
portion of the temporal bone.
Like around here.
Yeah, the part on the horse that moves, but on people it's all one piece.
Yeah, that's insane, isn't it? And look what we do with straps and ropes.
Yeah.
Which
so
is no, go on.
What I see oftentimes in horses that have ridden specific disciplines and they're older and they've ridden this discipline most of their life, their ears actually lose some of their motor function.
Yeah. Yeah.
So their ears almost just kind of stay,
Mm-hmm.
they look loose and kind of flopped out to the side.
Wow, that's really full on. And I think if we look at how horses operate in the world, whether they're in confinement or not, is they need to know where they are. Those ears need to move. They also need to see. So we'll look as well at the eyes. And I think I remember years and years ago when I started looking into craniosacral and riding race horses, and they were extremely noise sensitive because of the tension around their head and their ears. And poor fitting bridles. And I started to look at the role of the vagus nerve in this. So if you add deep muscle tissue tension and what we would call like, and stress and pressure, the vagus nerve is coming out up here, right?
Right.
So if that's under pressure, yeah.
Comes out.
Yeah, exactly. So if that's under pressure, it's going to stay in a sympathetic state. Now, if the vagus, which talks to the vestibular nerve, which is around the temporal bones around here, if that's tight, again, that should really only be used in extreme circumstances. What happens is the body the vestibular nerve and the balance system of the horse starts to tune out low sounds and will only pick up high sounds. So the horse will appear to be extremely noise sensitive because of this, like you said, that lack of movement, that lack of breathing motion, and that inability to regulate due to all of this tension happening over time, or from a severe pullback, or both.
Yes, their hearing and also their vision, because their eye socket gets frozen.
Yeah. So I'm going to get you to talk a bit about that. I've got some other photos. This is what I was doing yesterday. Now, here we go. All right. This is the horse's right eye. Look at that, beautiful. All those nerves going there. That's the second branch of the trigeminal nerve. So yeah, if like say they've had that pressure downward and backwards, or intense pressure over time, or as we're talking with, or held in flexion for long periods of time, and that can be in racing. It doesn't need to just be in certain other disciplines. When I rode track work in America, we were definitely had the horses like that a lot, and also over here in Australia. We know the horse needs to look up and out, and their vision is panoramic, right? So they've got beautiful letterbox pupils, so they need to see vista. Now imagine that then just being pulled down, and those eyes not being able to move and expand. I feel like those lateral muscles that operate the eye and the bone behind the eye that you talked about, the sphenoid, is going to become restricted in its motion, and it's going to cause a lot of stress. Yeah.
Yes, and the bones, they not only have the cranial rhythm, but they are designed to actually move. So yeah, and I see it all the time in before and after headshots of horses where the actual bones are almost pointed downwards.
Yeah.
Or one will be up and one will be down, so they look asymmetrical.
Yeah. And for a horse, we're just going to use horse as an example. If they cannot move their eyes, their head, and the neck right, they're not going to feel safe in their body, right?
Correct. They'll
Yeah.
be stuck in a sympathetic overdrive.
Yeah.
It's very important for them to be able to orient to their surroundings. And if they can't orient, either because their occiput and C1 is compressed, so they can't do that lateral swivel, you know what I'm talking about,
Yeah.
where they that motion, you know what I'm talking about?
Yeah.
Lateral flexion you can do.
Yeah.
I think Dr. Deb Bennett calls it head twirling, where you can if they can't do that, which a lot of them can't. I worked on one the other day. I asked for it, and there was like this little, it was really hard for him to do it, and his breathing would get fast when I would ask for that because he couldn't.
Oh, wow.
And I'm pretty sure he's had a pullback, but he also is ridden, in a very tight bridle. So all those muscle fibers that surround the nuchal ligament get tight and damaged and torn and compressed, and they lose that ability.
Absolutely.
So then they start overbending
to try and get some kind of relief, right? You touch on something really cool that I want to we want to talk to about people who might be thinking, well, what can I look for in my horse that might indicate there's tension there? So when you watch your horse moving, they should have a kind of like that going on, right? As they're walking.
Little micro movement.
Yeah. Just watch them like loose in their paddock without sort of having anything on them. If they're sort of doing this, or they've got a turn one way but not the other way, there's some restriction. And you might notice, I notice when I'm doing a gentle, like just checking the range of motion, if they blink one way, it's really hurting that eye socket movement, like you said, or they'll do that. Or if you ask them maybe to follow something and they can move their eye one way but not so much the other way. Yeah,
really, it's I think it would be really great to understand their eyeball movement, like get to know your horse's eyeballs.
Yeah. Get to know your eyeballs. I love it.
Do they easily turn in the socket, or do they turn only so far and then the horse starts twisting his head? I see a lot of that. And
they just start tilting.
Or
Watch
you
them.
can see too much white.
Too much white. Just watch them walking side on. If they're doing that kind of chicken walk. And watch them walking front on. I have to say, and probably you find it too, I don't see many that have that really lovely movement. You just but it's good information to go, okay, there's some restriction up there. And it might not just be up there, it might be from the sphenoid, from that bone in the head and the eyes. And allowing that bone to breathe again. Wow, doesn't that just start to free up so much?
Yes.
So I'm just going to pull up this photo so we can talk about. I put arrows all over this, but this obviously is what we're talking about, a pullback. This horse is hard tied. Look at that rope holder. Look at the pressure. This is what Shea was talking about.
Yeah, so look where it's right there.
Right there. Look at here. So this is what else is affected. All right. All of this. And add to that panic. I can't get away. Okay, I can't get away. Some may stop, but not many. If they get a nasty fright and they can't get away, and then look at all that, it'll start going back there, the pressure. So the whole system gets affected, right?
Yeah, and those muscles, so there's like the muscles that get engaged when the sympathetic nervous system is turned on.
Yeah.
And these are the top line muscles when those are engaged,
Yeah.
and everything's drawn down. And when they pull back like this, they get stuck in that sympathetic drive. They get stuck there. So even if they're not pulling back and they're just standing there, you can look at them and see that these muscles kind of stay engaged, keeping them in that state. And
Absolutely.
then it hurts, so they get pain at their in their pole area. And so they're going to have a more tendency to keep pulling back whenever they feel pressure.
Yeah. Yeah. And I mean, often I hear clients might say, well, he's pulled back, but now he always pulls back and now it's a habit.
Yeah.
But it's not necessarily a habit. This is an intense trauma for a horse. If they cannot get away as well, we've got what we would call an allostatic load in the system. So this buildup of stress that hasn't been allowed to disperse at all, you know. And so, as you know, what do we call a stress that hasn't been allowed to properly physiologically release? That's trauma, and how to address that. Even if he pulled back, broke away, and run away, there's still a lot to deal with. You know, he hasn't run away the pain or the pressure.
Yeah. Yeah. And then it's going to put pressure on the facial nerves.
Yeah.
The circle you have there.
Yeah.
And that's a sensory nerve. So that can get where it's, you know, firing all the time. So it's painful. So they may get to where they don't want you to touch their face or their ears or their pole.
I'll show another photo so that people can, where it is there. There we go. Yeah. So as Shea was saying, like, we've got the facial nerve coming down here. We're just giving you guys just some images of what's underneath all of that. And
yeah, right under the skin. It's not
right
like
under the skin. Yeah. Blood vessels. So obviously another thing that we will address in craniosacral work is the vascular system, you know, the flow of that. When that gets congested through this pressure, the vascular system for the brain will not be able to work properly. It'll feel like a trickle rather than a gentle pumping of clearing and providing nutrients to the brain and coming all the way down here. So the horse will actually look like they've got a foggy head, right? Like that real, oh God, you know, and like you said, the eyes aren't moving. So, you know, so important to get some cranial work done with your horse if you've had any sort of pullback. Even if you think, oh, he seems all right, you got to remember all those structures are underneath.
And they can just keep going and appear to be fine, but it's some side effects may not even show up for a month or so because they've been compensating. And then, you know, maybe one day they start to go a little lame on the left hind or whatever, the right front. And it could be associated with having a pullback.
100%. Wow. I mean, I love that you mentioned that because again, so often although it is changing, people go, well, the horse is lame there, but actually let's get a full history. And Michael Shea talks about that. Always get a full history. Even if the horse has moved, what do you know? Had they had a pullback? I'm not with me, but perhaps before they're breaking in, their starting was really hurried. They may have had compression at birth. They may have fallen. We don't know. Let's assume something may have happened to the head. And then, like you said, 10 years later, they've got this right hind issue, or they've got this front end issue, or their breathing isn't good. So something that I've sort of got introduced to recently was how important the heart fascia and the diaphragm fascia and the liver is to the brain. And imagine if the brain has had compression and head compression from a pullback, all of that gets affected. So when Shea and I are working, we're going to address the shock in the system through the diaphragm. That must be addressed first before we can go deeper. I'm sure you found that, like with that beautiful video you shared of that young horse, that horse you're working with, you're working behind his pole. Like, it's taken time for you to get there, because obviously the first thing you've got to do is help address that shock in the system and get some sense of, hey, I feel a bit safer.
Mm-hmm.
And then we can work around the chest, help that breathing, and then get to the head. Yeah.
Yes, that horse was he has a lot of nerve pain.
Yeah.
So,
is that the one with the facial nerve pain as well? Yeah.
yes.
Beautiful. You were able to get straight to the sphenoid. I love that.
Yeah, it took a minute, but
so, yeah, tell me a bit about him. When you first met him, he's had pullback injuries, is that right?
I'm pretty sure he has. He was a kid's horse that was used for jumping, and he's just a mess. He's really not. He's very traumatized, and he's not very settled at all. And he's been ridden with an over tightened bridle, very heavy, overflexed. And so he has a lot of pain, and he's difficult just to walk in his space. He gets very defensive and moves around a lot. He quiets during the cranial work, but and there's another one that I've been working on recently. They had to muzzle just to lead him around. He had to be sedated to get his feet done. Muzzled to take to the cross ties to tie him up, to groom him, saddle him. He couldn't handle massage or any kind of that type of body work. And the trainer would slap him anytime he would pin his ears and throw his teeth at somebody. Gosh. I also did his saddle fitting, and I would feel he was just in pain everywhere. And so I started after one cranial session. This was so incredible, because it was just the therapy that he needed. And he doesn't have to wear the muzzle anymore. He's sweet. Like, when you put him in the cross ties, he's just all mellow and relaxed. And it took me about 4 sessions before I could get behind his shoulder. So I would just focus at his head and, start to go back a little bit. He'd flatten his ears and step into me. He's an aggressive horse.
He's in a lot, like you said, a lot of pain and not feeling safe, right?
Yes, totally.
Yeah.
And but now he's relaxed in the cross ties. They don't have to sedate him to get his feet done.
Amazing.
He lets me do back in his pelvis now. And he's one that he's very sensitive with where my mind is. So if I take my focus away from his system and expand out to the horizon, which I like to do sometimes to give their system a break. If I do that with this horse, he comes out of his cranial stupor and he'll pin his ears at me.
So he prefers you being sort of quietly there with his wholeness, rather than out.
Yes.
That's amazing. Because I've had, like you said, both, where some want you to be as far out as possible and don't come in too much.
Yes, I've had that too.
There, right.
He needs to be right there. And I told his owner watches the sessions. And so it was cool for me. And I would say, look, I'll even do it. And so I'd my brain, like where my thoughts are. And he was right there with me the
It's
whole
like,
time.
I'm feeling you move, stay here.
Yep.
Oh,
Yeah.
that's so beautiful. But like
Yeah.
I've also had that too. I love that you said that with horses that have had this severe compression that really takes them out of their body. Like they feel like they're just not there. Like they don't know where their front and their back is when there are people around. That I will spend most of my time at the front, forward of the shoulder, because I can't get to the back because they're like, no, 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 I don't want you there. I don't feel safe there having you there. I don't know that that's me there almost, you know?
Yes.
Yeah. And it's just to be patient, let that happen. It's, yeah. So pullback injuries can take time. It's not a quick fix. The first thing that we need to do is help them feel safe, know that we're here to listen to their nervous system and help dissipate that shock, right?
Yes.
Yeah.
Help the system get rid of the shock.
Yeah.
And I have some pictures of a horse that has facial nerve damage
Yeah.
from pulling back that we could look at if you
Yeah,
want.
pull them up if you've got them. I was going to say it'd be good to also just look at Robin and Teresa's questions before we wrap it up, because they put a couple of questions about their horses. So yeah.
Yes.
Craniosacral chat 3.
Let me find it's in a lecture I just did.
Oh, amazing.
Um
Was that the iridology?
No, a craniosacral lecture I did, like what is craniosacral?
Love it.
Let me do the screen share. I'll just pull up this whole thing because can you
Yeah, go
see?
for it. Not yet. You should have
Oh, I see. I'm not doing it right.
that's it.
Okay.
Okay,
I'll
perfect.
put it on the slideshow.
Yeah.
So this mare had,
Yeah.
first, she does have a rope halter on, but
Yeah.
I don't mind rope halters if they have a release system.
Yeah.
And they're loose and lightweight and soft.
Absolutely, I agree. I feel that if I'm working there with a horse that's had some pullbacks, I just want to have that. And I will encourage the owner to get a fluffy halter where possible. If they need a rope halter to lead them around, absolutely. But for tying, it's nice.
Yeah. They're better than using a chain.
Oh God, yeah. Yeah. That's an amazing shift, Shea. That's beautiful.
This was after one session.
Yeah.
So you can see this horse has actually she actually fractured. Well, I don't think it was x-rayed, but you can tell the temporal bone has been fractured because it's, it's not shaped. It's kind of flattened. She got her head caught up in a feeder, some kind of feeder.
Oh, wow.
Panicked and pulled back. And when I first met her, she had a head tilt. She looked neurological, but her face, you can see her facial nerve is actually damaged. So lip curl.
All soft, almost looks soft and sort of flaccid on that side of her face, doesn't it?
Yeah. And she holds her, like her tongue she holds her tongue out of the side of her mouth. And then her muzzle is actually curled off to one side. I've been doing this horse for, gosh, 7 years. I see her once a month. And I just saw her yesterday. I should have gotten a face shot because it's even better. It's not going to restore, it's not going to completely heal the nerve damage, but it helps some of it restore, and it helps the whole system softens enough where everything else can function.
Absolutely. Exactly what you're talking about. It's like you're just freeing up those blocks that have happened in that river and allowing that to flow. So it's not like that river isn't there, just for people to know it's there, but through like that soft touch and awareness, that'll shift And your nerves can heal like a millimeter a day. They can regrow. That's
Yeah,
another
they
one.
can.
Is that the same mare?
This is the same mare.
Yeah.
So the picture on the left was,
Wow, amazing.
look at her body. It has all that sympathetic overdrive with
Oh,
everything
yeah,
pulled down.
yeah, yeah,
And then
absolutely.
the picture on the right was, I think that was a few sessions. Oh yeah, that was 3 years later.
I love that.
Yeah.
Wow, look at that health. She just looks, you can just feel the health coming through that second photo where it just looks all compressed before.
Yeah.
I've got actually do have a photo to share of a horse who I don't know if he had pullback. I guess he did, but he was ridden in tight flexion. So again, just want to show
Okay.
like you said, what can happen when that head is compressed. Oh, look at that.
Oh, so here's an example of the bones, how they can actually be shifted. That was after just one session.
That's beautiful.
So I don't know how to stop. I don't know how to stop sharing.
Oh, I think you at the top of your screen, it might say stop share, but I'm loving these photos.
We can go through them. I mean, this is
Yeah.
that same horse. He had that same posture. Doing
Wow.
photos of your horse is really, I mean,
So
look at his
important.
side. That was after one cranial session.
Yeah.
The change in his hips.
And look at him, like, I feel better, thank you.
Yeah, his little face.
Often I'll see horses have that, like a foreleg back and a hind leg forward in that kind of crouched position. And,
yeah, like the staggered.
Yeah. And I certainly know there's some amazing teachers out there, you know, from Terza to Raquel, who talk about owners getting to just look at their horse's posture. What's it telling you? You know, if there's contraction and compression, what's going on? And, you know, from a craniosacral lens, that's going to tell us a lot, how they're walking, how their head is, how their posture is. Oh, wow. Look at that.
Yeah. Yeah. This was a horse. The photo on the left was, that's how crooked he was. That's just how he stood all the time.
Yeah. Yeah.
Yeah. These are just regular craniosacral, a little mini.
Oh, look. Wow. Like you said, the color comes back in their coat as well, you know?
Yeah, they get glistening.
Oh yeah, I remember this photo. Yeah. Great one of the bridle.
Okay, here's a bridle. This is advertising an anatomically correct bridle.
I've seen that bridle. It seems to be covering more areas of the face than a regular bridle.
Yeah, look at it's right on the facial nerve. It's directly in the TMJ. It's pressing on the back of the ear.
Yeah. And covering all those sensory nerves of the face. Now, it would just be like having something on your face all the time. Like horses feel with the space around their face to move around and get where they are in space. And, you know, that whole facial nerve has branches and the trigeminal that talk to each other, and they're sensory. And we're just shutting them off.
Yeah, shutting it down. This can have the same effect as a pullback injury.
Absolutely. Yeah. Like we said at the beginning, those the dura of the spinal cord that envelops the brain and the cranium is also continuous with the entire fascial system of the cranium. Wow. So look at that softness.
Yeah, I'm actually trying to get at it. I'm trying to stop the share, but I don't know.
I think at the top, if you go to the top.
Here.
Oh, okay. I'll just quickly, because I've also wanted to just so let's have a look at I'm going to look at this one. There we go. No, that's not it. Hang on a minute. All right. Oh no, I'm not. Here we go. So this guy was he'd had some work with a spinal vet around, you know, his back end. But this is how he stood. See how he kind of looked like two horses.
Yep.
And he
And
just
he
always
has
had.
that same dropped neck.
Mm-hmm.
Yeah.
Yeah. So that's him before the session. And here we go. Here we go. That is after.
Oh,
Just,
wow.
yeah. Or so what I think, Shea and I were saying, when this starts to be able to move, look what else opens up, the entire session was actually around his head because he just needed to move through the session. He wanted to move. So I just stayed around the head.
Wow.
And that just, a lot of pressure up here, around that full.
It's amazing how we can only just address the head and the whole body changes.
Yeah.
I'm still fascinated by that.
Me too. I'm fascinated. But I know Hugh Milne and of course this osteopath I saw in London, they talk about if the sphenoid gets restricted, the heart suffocates, the sacrum stops moving. There's such a huge link. I know we're still talking about certain areas of the body, but just sort of think, I always think about nature. If a dam gets blocked by a tree, that water can't flow, and then it might flood the other areas, and other areas get congested and start to degrade. And the whole scenery changes. But if you remove that, if it starts to be able to shift again, everything starts to breathe again. So have we got time to quickly chat about Robin and Teresa's horses? Yeah, so Robin Wogerman, I think she talked about her horse, Ziggy, was it? Who had EMS?
Pull that up. EPM.
EPM, sorry. Yeah.
Close.
I got the first letter right.
Yeah.
And one of the other letters. But she certainly she definitely touched on he had a pullback trauma, this horse.
He had a pullback while he was getting a dental float. So let me find her question.
Oh yeah, I've got it in my phone here. I mean, we want to touch on this further. We won't for this chat because obviously we're coming up to the hour mark. But there's been human research, and Shea and I have discussed this a lot, between traumatic brain injuries, mild to severe, and the link between the gut. In human studies, they have within 48 hours monitored that 2 bacteria go missing from the gut in athletes who have had mild to even a mild concussion on impact. So it's actually an invitation to really explore this in horses. What bacteria go missing? What are the effects on the metabolism from head injuries? Both Shea and I do iridology. In every single horse that we've seen has head compression, there's definitely a gut issue, right?
Yes. Yeah.
Not one exception. Yeah.
Yeah. You can see it in their iridology reports, or in the tissues in their iris.
Yeah. It's important to know that the brain tissue takes the longest to heal. So, remember, if they've had a huge rebound effect, which we call contre-coup, that reverberating through the skull will have effect on there's a structure called the endothelium, which is entire in the body around the vascular system and the gut. So that, to simplify it, the messaging gets warped, or it starts to not happen. If the horse already has some gut issues and then a brain injury, there will be a comorbid factor of there being a delay in the head injury to heal, and then the feedback loop. So what do? We address both, right? Right.
Mm-hmm. Yes. And to add to that, if you think about our immune system, like 80% of it is in our guts.
Yeah.
80% of our immune system comes from the health of our digestive system in our guts.
Yeah.
And which touches on Robin's question, where she said, have you ever experienced EPM causing prolonged head shaking I believe my boy may have gotten EPM through a trauma of a pullback during a bad dental. So he probably had the speculum cranked open, pulled back. I've seen that. And
I
it's
remember you
pretty,
saying that. That's pretty severe.
and shortly after that, he developed EPM.
Interesting. Yeah.
Yeah, and it makes me wonder if he ended up with a little bit of if he became neurological from that pullback trauma with the dental. But if it's affecting the gut, then the immune system's going to crash as well.
Yeah,
It's going to
absolutely.
leave susceptible to things like parasites, EPM, things going around, but parasites and EPM seem to be the biggest issue with horses. So
Yeah.
Robin's horse is still a little neurological.
Yeah. And that's, like you said, why it's so important to get that full history, isn't it? How is that head functioning? Are there restrictions? Has there been compression? Has there been dentistry issues? PTSD, in horses. Certainly Michael Shea talks about this, that it's a comorbid factor as well, because healing from a brain injury may be greatly delayed and exacerbate pre-existing symptoms driven by the autonomic nervous system. So if that stress is in the body, absolutely it's going to delay. So that horse had so many factors happening. Stress. Yeah.
He could have had exposure to EPM prior, and this trauma kind of made it react in his body. He couldn't. So a horse like this, I would probably get his blood work done and make sure the EPM's cleared. And watch, like, how does he chew? Does he use both sides? Like when a horse chews, they use one side for a while and then they should switch sides. I actually videoed my horses and timed them, and it was about 9 to 15, 16 minutes.
That would have been a good video. It is for us.
I know. All of them, they were all eating at the round bell, so I just videoed them.
It's actually, that's a very good point. And in January, I'm hoping that we can do a 3-way conversation with a natural balance dentist called Fiona, because she talks about that a lot. I know natural balance dentistry is, a lot about it as well. To really, watch your horses chewing. Are they going right to left? Does it seem like this? Like there's not a full range of, are they almost doing that? If they're doing that, so what's going on with the jaw movement, Yeah,
and are they, like, when they pull the hay or the grass, are they using their neck correct to do it? Are they pulling it? That makes sense what I'm trying to say.
No, it absolutely is. That's like the primary center of the bite is actually around that atlantoaxial joint. It's the same with us. Ours is obviously here, but if that gets compromised, it affects our bite. Yeah. Powerful stuff. The dens, which is such a cool little structure on C2. I'm getting a bit nerdy about that. But it's just so important to, like, if they've had a pullback, that's then going to affect how they eat their grass. That then may affect how they're chewing. And, the list goes on. And then maybe how they're digesting their food. Yeah.
If your dentist is saying, oh, this one side is constantly high, if the teeth are not, I've actually had dentists report that horses that were getting craniosacral, their teeth erupted faster and more even.
Beautiful.
Because it helped the mechanics of their jaw.
Yeah.
I've had that feedback a few times from people.
I love that. That's amazing.
The dentist like, wow, your horse is not as out of balance as they normally are.
Yeah. I think you're freeing up all that fascial network and the blood vessels, so everything can function better, allowing for more growth. Oh, wow. What great feedback.
Yeah.
So do you know someone that Robin can use? She's in New Mexico.
She doesn't know anyone out there. So I tell people, if you can't find an equine craniosacral practitioner, Google a human one, and
Mm,
they may either do animals on the side, or
mhm.
they may know somebody.
Yeah, yeah. Or do
But
Shay's online course.
yeah,
Yeah,
yeah, it's going to give
yeah,
you basic stuff you can do definitely to help them.
brilliant.
But yeah, I would check his blood and do things to make sure his gut bacteria is healthy, his
Hmm.
immune system, immune boosters,
Yeah,
stuff like
keep the diet as simple as possible. Avoid the high processed food, anything that the
that.
gut's going to struggle to process anyway.
Yeah. No soy, wheat, corn.
Yeah, none of that stuff. But,
Yeah.
um,
And then we
sorry,
have Teresa.
we've got Teresa. Sorry, Robin and Teresa, we've left you till the last, but Teresa had a very interesting one that we had a little chat about with her horse wanting. He sort of pulls back a little bit about pressure, does it against pressure, like he's trying to shift something, right?
Yeah, her question was, why do some horses prefer to stand tied with pressure on the pole?
Yeah.
So the horse will pull back until the lead and halter are taut, and then voluntarily stand like that with constant pressure on their pole.
Yeah.
I've only seen that maybe once.
And I have seen it probably a couple times. I was trying to find a video. I meant to get it for this talk, but I was just seeing a Brumby not so long ago, and we had him just soft tied. He had my soft halter on, but he just would twist his head under, not trying to get the halter off, and just apply pressure to the rope around the side of his head. And that's why I was like, he was caught in the wild. Birth compression came in a bit as well around that spheno-basilar joint, like almost a twisting feeling, like they can't quite shift that pull. And my feeling, like we talked, was that they want to try and meet that compression to dissipate it. Right.
Mm-hmm.
Didn't you mention when you've had frontal bone pressure, pain or impact, that you want to almost push against that?
Yes, I had, when I trained horses, I only fell off 2 times my entire training career, and I trained pretty messed up horses because I was known as the person to take the most troubled horse to. And
That's amazing. Well done.
the 2 horses I came off. One was a Peruvian Paso.
Oh my God.
I know. And one was a lesson horse. They were both like the least, and this because I wasn't expecting it. The horses, I was anticipating it. I was present at every moment.
Mm-hmm.
The other horses, I was, not paying attention. And anyway, I think she got stung by bees. I got bucked off. As I was falling, she's turning, and the land was fine because I landed, I aimed for a big pile of leaves I saw. And then she turned around and she jumped over the top of me and clocked me in the head with the tip of her hoof, caught me right here.
Yeah.
And it didn't break any skin or anything. It didn't break any bones. Nothing. It wasn't even that hard. It was like it just barely grazed me. But the pressure was so intense.
Mm-hmm.
I was constantly wanting to press on this bone.
Yeah.
And this was a long time ago. And yeah, I was, at the end of the day, I would just sit inside and press on my forehead because of that pressure. It was like an elephant was on my head. And I went and got craniosacral, and it went away completely.
Amazing.
And about a month later, it started to creep back in. And I felt myself, wanting to do this again. And so I got craniosacral again, and it went away. And then about 5 or 6 months later, it started to creep back in.
Wow.
And so I went and got another session, and then it's never come back since. But
That's
yeah,
that's
I
a great
wonder-
story, because you've also highlighted the importance of getting a few sessions, because the layers can be kind of deep.
it can be deep, and it can go okay for a while and then start to creep back up. And it could be like mine was months later,
Mm,
and there it was coming back.
amazing. I mean, I've had a nasty fault at the back here, and I want to always pull back here. It shifted quite recently after a number of craniosacral sessions, but it was actually related a lot to the heart fascia, interestingly, which I love. Like, personal injuries get you to explore more, right? But it's like Teresa's saying, her horse is, my feeling is that he's trying to meet the compression that he's feeling in. And I mean, as practitioners, sometimes the bone wants you to meet it. You'll find those horses that want to rub on you and push on you a lot here with their forehead. They might say, oh, he's just in my space. But I'm like, maybe he's feeling pressure in his head from a head injury that hasn't been looked at. And so sometimes, and I'd love to hear your experience on it as well, please. I will either meet that compression and not push back, or have a soft contact, like you say, with an open presence, and orient into the bone and meet the stillness there, right?
Yes.
Yeah.
Yes, I love that.
Yeah.
Yeah, I just worked on a horse that was head shaking probably 2 days ago, and the trainer kept saying his previous barn, they punished him a lot because he always wants his head in your space.
Right.
He was terrible about putting his head in your space. And she said, I just figured it's because his head hurts. And it is, he does head shake. And I noticed during the session, if he couldn't rub on me, he would go to the bar and he would curl his lip and just press the bar into his incisor bone really hard. He would just press into that. So yeah, and Teresa even said she wondered if it was because they were trying to relieve pressure that they felt in their head.
Yeah, absolutely. I feel like she's on point with that. I was just thinking exactly of the video. I'd shared it to Sarah Schlotte's course in equiscience, but it's somewhere in a USB there. We won't have time to look for it. But this horse was at the track, and at the end of the morning, he would hold on to the grill bars and pull like that. And I could almost feel like he was trying to pull this so much pressure through his cranial base, through the ventral part of his head, through to the back of his head. And he used to pull under saddle a lot. I didn't ride him, but
wow.
Yeah. And if you have a headache, you kind of do that, don't you?
Yep.
Right?
Yeah.
So it's always good to consider, isn't it? Your horse, they might not be just trying to understand boundaries. They might actually have pressure in their heads, and they're trying to relieve it some way.
Yeah. Look at cribbers. Horses that grab things and then pull back and suck.
Yeah, you almost feel that voma wanting to just oh my goodness.
Yes.
So I hope that answers Teresa's questions. Has she had a craniosacral person? Is she near you?
No. Where are you located, Teresa?
Yeah, get in touch with Shea and find out so she can find out where you are.
Yeah, I don't know if I have any other answers. I don't know if we answered that other than agreeing. Yes, it's probably pressure, probably head pressure while he's doing that.
Yeah.
He'd stand like that for 10 to 15 minutes before taking the pressure off himself. He was a Western pleasure horse, so not ridden with contact. He could also be spooky, but that got better after he came here and gained more confidence.
Yeah.
The spookiness can also be head compression.
Yeah.
And when they do feel okay and safe with their handler, that stuff does dissipate some.
Yeah.
He was 6-year-old, dropping his feed when eating.
That's another really interesting point that you
Power
talked about the chewing. You know, can he do that? What's going on? Check the dentistry. It's important for the craniosacral therapist to work with the dentist wherever possible, you know, when we have that.
Yeah, she said he was receiving power tool dentistry.
Okay.
And I had confidence in the practitioner, yet she couldn't see a reason for that happening. Never got better. Wish I had a video of him chewing, but the pulling back on the halter, dropping the feed, and the spookiness were all symptoms of something we unfortunately never figured out. I do know that some Western pleasure trainers do what they call, actually, I can't remember what they call, but they tie the rein to the hock, to the back leg.
Wow.
Because in the show, the hock is not, or the back leg is not supposed to extend behind the tail.
No, it's very shuffly, right?
Yeah, they're and I know nothing about Western pleasure, so I'm probably, you know, jacking all this up. But it does cause them, like, they'll do that when every time their leg goes too far back. So some of them you see, and they kind of travel like that. I have seen some of them also tie their heads to their to the stirrup or the saddle. You know, they'll tie their head around and just leave them like that.
I've seen that.
And all that stuff can cause tightness and pressure, especially if they panic and fall down with their head tied around. So it could have, you know, not knowing if he'd had this kind of training, he definitely, I would say there's definitely been some kind of head trauma in order for a horse to spook, drop feed, and use that pressure
to try and relieve something that can't. Yeah, it's it's just so important, isn't it, to always consider the head and observe your horse, like we touched on. Observe them walking, observe them eating, observe their eye movement. Yeah, we have gone on for an hour and 15. We were only going to do 45 minutes. I don't know how we were going to do that, but that's okay.
I don't think it's even possible. So
no.
We just need to plan.
We probably should wrap it up though. Sorry, I would love to talk for another hour, but perhaps we're certainly hoping to continue these talks. We might do it slightly differently. So watch our pages for further developments. I'm hoping we can do them live. What do you reckon?
Yeah, live one would.
Well, you can do live now. You've done it. You've done the summit, so you're the live pro. I'm not a live pro. So yeah, that would be amazing. And that we can have people coming in and interacting. So we're just going to figure that out. And yeah, that's going to be so exciting. So watch this space. Shea, Stewart, thank you so much for your time.
Thank you. That was great. And if anyone has questions, they can just ask when we post this link. You can ask in the thread part of it.
Absolutely. Fantastic. All right. So goodbye for now, and we will be in touch with more developments. And yeah,